My name is Deb Pavlica, and I work as a nurse at Boynton Health at the University of Minnesota. I am still a frontline worker. Myself, along with my fellow frontline workers, have risked our lives and that of our families and loved ones simply by going to work and doing all we could to take care of sick patients and keep our state running. We ask for recognition from the legislature for the risks we took every single day. We never got to work from home. We paid to commute and paid to go to work. Our fight was for frontline worker pay. I was proud to have added my voice and shared my story with the Frontline Workers Pay Working Group that we and our union helped pass through the legislature and with our continued fight for more than $1 billion for frontline worker pay. $1 billion would have meant roughly 660,000 workers would have received $1,500 checks. But because the state Senate objected to providing all frontline workers with the appropriate hazard pay, they cut the total to $500 million. They wanted to use some of that frontline worker pay designated for those frontline workers to correct misappropriations to the state's unemployment program. This was incredibly disrespectful to all of us, all the frontline workers. Our union pledged to never stop fighting for the second half of that frontline worker pay that we deserve and most certainly have earned. COVID 2020, that changed my life forever. Currently, I am diagnosed with PTSD from working throughout the pandemic. I had long hair, but I cut it off myself one day. After swabbing infected patients all day, I felt like I was just covered with COVID and couldn't get rid of it. I started antidepressants to help me cope and survive, to help me sleep without the ongoing nightmares of breathing my last breath and dying alone like so many did. I didn't see my children or my grandchildren for well over a year and a half to protect them from me, as my job placed me in a terribly high-risk category for COVID. I spent heartbreaking hours preparing to die from COVID. I am a widow and lived alone, and then lived alone for almost 2 years, alone and scared, holidays, birthdays alone. Isolated and so lonesome, with such guilt for choosing my career. Once thanked and revered as heroes. Then vaccinations decreased the numbers of COVID and COVID deaths. Now the legislature treats us as insignificant. Our jobs had served their purpose and saved so many. Human beings should never be taken for granted. We have continued to do our jobs with compassion and excellence. It has been incredibly difficult during this COVID pandemic, prior to getting the vaccines, when we had no idea if we would survive. We fought for effective and enough personal protective equipment, which we were not initially provided. We were asked to reuse the same protective equipment for days on end, contrary to what experts were recommending. I am proud to stand alongside so many of my union siblings, frontline workers, in testifying both in front of the work group and the legislative committees. We will continue our fight to provide our frontline worker heroes with frontline worker pay. Here are some of my fellow colleagues' stories.
We are very concerned with the Delta variant, as not all security counselors are N95 fit tested. We are inquiring about our stock of N95 masks in our warehouse and seeking to have all security counselors N95 fit tested before we have another outbreak, so we won't experience the exposures we did last year. We still reported to work every day because our jobs as essential workers require us to. Everyone who endured the increased risk of uncertainty during the worst global pandemic to keep our state essential services functioning should be recognized and compensated financially. They are the true heroes.
I am a DVS examiner and inspection specialist for the state of Minnesota. I'm also a member of the AFSCME Council 5 Local 3142, and I represent over 100 examiners throughout this state. And we are asking that you would consider us and determine a plan as you determine the plan to distribute funds for the frontline workers. As Minnesota started to get a grasp of the new virus, examiners were brought back in for the reopening. By late April and early May, our days were filled with completing CDL exams, which take about an hour and a half to complete. It soon progressed into, as the examiners, we were sitting in 15 to 20 minutes at a time in each vehicle. We did not know if the customers were infected or not, and we were just hoping that they weren't infected and not spreading it not only to our families and our workers, but also to each car that we got in.
I'm here to ask for your recommendation for us to be part of that K-12 hourly workers group who did daycare from day one of COVID-19. As you are well aware, we were charged with delivering free food right away in 2019, and we have been working with kids officially and non-officially ever since. We love to keep those, and it's important to keep those relationships with the kids, to keep them engaged, to make sure that they are being connected with every single day. And that's just who we are, because we love kids and we love everyone's kids who come, their family to us. So it's very important for us to be connected all the time. However, during the pandemic, I wanted to put a face to the name of some of the thousands of paras and clerical workers and school workers and bus drivers and cafeteria workers and other school workers that took care of the kids of these essential frontline workers. We had kids of doctors and nurses, and it was so important for them to be at school because they needed to be there taking care of our family members and your family members and everyone. And these were dangerous tasks. And it was us. There's thousands of us.
My name is Jamie Smith, and I'm a paraprofessional with the Duluth School District. I am a member of AFSCME Council 5, and I'm testifying today on behalf of my local union. We, as paraprofessionals, were reassigned to help provide childcare to other frontline workers who were unable to stay home and assist distance learning with their students at that time. Without my colleagues and myself, frontline workers with young children in hospitals, nursing homes, and countless other locations would not have been able to report to work.
As a frontline MnDOT employees, there is no part of our job that can be done from home. We have continued to go into the work since the start of this pandemic. We, like everyone here, are more than essential workers. We are parents, spouses, siblings, and someone's children, any and all of whom find us essential. So many of my coworkers have been stretched to a breaking point. We have little reserve left. So many are on the verge of leaving. Some already have. We're asking for our work in the past and moving forward to be recognized for what it is, essential.
I'm a corrections officer at a Stillwater Correctional Facility. I'm a member of AFSCME Council 5 and the president of AFSCME Local 600 at MCF Stillwater, where I've worked for the last 16 years. I'm testifying on behalf of the AFSCME Correctional Policy Committee, which represents correctional officers at all of Minnesota's correctional facilities. My coworkers and I have been on the front line of this pandemic and continue to risk our safety to keep Minnesotans safe. Please include correctional staff in the frontline worker pay. The earliest months of the pandemic were the most demanding for us. Before vaccines were available and before we really knew what we were dealing with, when workers all over the state were protected by the stay-at-home order, and just as the virus began spreading through our facilities, correctional staff lived with the daily threat of contracting the virus and spreading it to our kids and our spouses. Prisons are a petri dish for a virus like this. Congregate living with all non-porous surfaces and stale air. It's not feasible to keep all these surfaces clean dealing with the populations we do. And remember, early on, there were so many unknowns. We had members sleeping on cots in their garages or in their driveways and ice shacks to protect their families. Parents who couldn't embrace their young children or hold their babies because they were certainly exposed to the virus and didn't want to endanger their families.
My name is Carmen Brown. I'm the Vice President of AFSCME Council 5 and President of AFSCME Local 977 at Hennepin County Medical Center, which represents the clerical and general services who make HCMC run. When you enter HCMC, the first person who greets and screens you for COVID-19 is that clerical worker. For many months in the beginning of the pandemic, while we didn't receive enough information or know enough about COVID to protect ourselves, we went into work every single day to keep our state running. While we were the first person who would greet you at our hospital, we were the last to receive personal protective equipment. Our healthcare assistants monitor your loved one's blood pressure, take temperatures, etc., and are required sometimes to sit 24 hours in a COVID patient's room to watch and care for them around the clock, they're being exposed at great risk to themselves and to their families. Our environmental service workers go in and out of COVID rooms to make sure they are sanitized and clean for the patients we serve. The food service workers bring in food 3 times a day to each and every patient to provide them comfort and the necessities of life. We are all considered essential employees. Now, Senate Republicans want to limit frontline worker pay to only healthcare workers. I am a healthcare worker, and as a healthcare worker, I am offended that Minnesota state Republicans are holding up paying all frontline worker bonuses. For those who kept our state running during the most difficult times we have experienced in generations. Not just healthcare workers kept our state functioning during the pandemic and we must ensure as many frontline workers as possible are compensated for the bravery and perseverance they have shown at work, often at great risk. More than 12 members of AFSCME Council 5 have testified and encourage you to listen to their stories and to the stories of every union represented on this press conference today. Senate Republicans should not pit certain frontline workers against each other. It takes a team to ensure our state functions at all levels. We work as a team, and the team should be respected and to pay all the team members.